Tearing at delivery. It sounds like your absolute worst nightmare, but today I'm going to tell you 3 things that you can be doing towards the end of your pregnancy that can help prevent tearing. And I think you guys are really going to appreciate these because it's nice to know that you can do something to help your body do something better during labor. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 babies of my own. Side note, had a big old tear on my first baby. So I'm a big fan on anything you can do to decrease your tearing. I gotta say, I took a birth class where they were just like, it's gonna be sunshine and rainbows when that baby comes out. And that did not do me any favors. I wish I had taken a birth class that had actually prepared me for what my body was going to feel like after I had a baby, including the anxiety I was going to feel and how sore my bum was going to feel. Plus, nobody talked about these things we could do to prepare our bodies for delivery. So I wish I had just taken a better class, which is why when I created the online prenatal class for couples, I have a whole chapter on taking care of yourself postpartum. We talk about perineal stretching during the class. It's so important that you take a class that goes from beginning, meaning 3rd trimester, to the end of pregnancy, meaning postpartum. So many classes love to just gloss over or even make the postpartum section like a different class. Don't do that, guys. Come take the all-in-one birth class with the online prenatal class for couples. So in addition to getting prepared for your birth, let's talk about the 3 things you can do to prevent tearing at your upcoming delivery. Okay, first off, I got some bad news, okay? And then we're going to get to the good news. Don't worry. The bad news is there really isn't anything you can do to prevent a small tear at delivery. So first off, do you guys even know where you tear? So as the baby comes out, it's coming out the middle hole. Here we are at the bottom of your pelvis in case you need like a landmine. So the pee hole's up at the top, the baby hole's in the middle, and then the poop hole's at the back. And that middle hole is where the baby is going to come out. And most often you tear between the baby hole and the poop hole. Although you can tear any place in between that, including extending out to the sides. There really is nothing you can do to prevent small tears. Now, we as medical professionals, we grade these tears. We're not taking like a failure, which is what my first baby would have been. It would have been a failure. But we're talking 1st, 2nd, 3rd degree. So 1st degree means a very small tear. 2nd degree means a little bit more. 3rd, we're starting to involve ourselves in the poop hole exit. And 4th degree, we are heading right into that exit area. So we grade them. And the 1st and 2nd degree tears, I have not seen a single study that shows any way that you can really prevent those. Now, 1st and 2nd degree tears, much easier to recover from, much easier to manage, and less likely to have complications versus a 3rd or 4th degree tear. So that's the good news, but I don't want you guys to think that these things are going to entirely prevent you from tearing. Hopefully it's going to make it less of a tear, and hopefully you're going to be able to recover faster because studies actually show that some of these things help you have a better recovery, which is absolutely awesome. And again, wish I had done it when I was pregnant with my first baby. Okay, the first one is perineal massage. Now, this is where you are massaging those tissues to hopefully help them stretch for baby to come out better. Now, not everyone should be doing perineal massage. First off, if you have any varicose veins in that area, you should not be doing it. If you've had preterm labor and your doctor has preterm labor concerns for you, although usually when we're starting perineal massage, it would be after the preterm labor concerns have resolved because you're far enough along in your pregnancy. And if you're not planning on a vaginal delivery, you don't need to try this. And there are some concerns that you shouldn't be trying this depending on why you're not having a vaginal delivery. Of course, with perineal massage, you want to talk with your provider. And actually, it would be awesome if they showed you how to do it because my little demonstration here might not be enough for you. Okay, so a lot of people are thinking they're sort of like getting in there and massaging the whole birth canal. No, you are just massaging the perineum. So your perineum, there are 3 different holes on your bottom. Now, I've had this conversation with lots of patients, so if that's newsflash to you, here we are. We're having this conversation. Now, this is your uterus, but I'm going to use this as though it were the exit hole for your baby. This being the birth canal today because it's my best thing that I have around the house. So if this was your perineum, up here would be the pee hole. And down here would be the poop hole. And this is your birth canal. And where it touches the skin, this is your perineum. Some people call it perineum. I call it perineum. Take it for what it's worth. And usually where you tear is between the baby exit hole and the poop hole. So just so we know what we're talking about. Now you're looking to stretch just the tissues as the exit hole comes in contact with the skin. You're not looking to get like way in there. That is not what we're here for. You are looking to just massage this area. Lubrication is going to be your friend with this one. Some people just use water. A lot of people use KY jelly. talk with your provider to see what they recommend, but you're just looking to stretch these tissues for a brief period of time, probably as you head into your last month of pregnancy. Now, studies have shown that if you do this frequently, you don't have to do it daily. I think it's like 3 to 4 times a week. You're looking at less likely to have a 3rd or 4th degree tear and easier recovery after you have your baby, which is absolutely awesome. So I think this is a worthwhile endeavor. However, some people like trying to get around your baby to get down there to massage it. You might want to engage a partner, or probably a partner. I can't think of anyone that I would be like gung-ho to do this on that I'm just friends with, but usually your partner would be willing to get engaged into this process as well. Maybe bring them to one of those appointments so that your provider can educate them on how to do it. And just a quick reminder, talk with your provider before you're considering doing any of these things, okay? Thank you so much. Okay, the second one that has been proven to prevent tearing is warm compresses at delivery. And the word compress, I'm always like, what the heck is that? For me, it's always just been a warm washcloth. Sometimes they'll tell you to put a warm compress on your eye if you have like a sty or something like that. For me, it's always been a washcloth with warm water, which I change out about every 5 minutes to make sure that it's staying warm. Same thing for your nurses. We can just bundle up some washcloths at the hospital, sometimes 1, sometimes 2, depending on how thick or thin the washcloths are that have come in from laundry that day. But we're just going to apply that to your perineum so that it helps those tissues stretch a little bit more. Now, as you push, sometimes those tissues will swell a little bit. If you are only pushing 5 minutes, like this is your second baby and you're only going to have to sneeze and this baby comes out, probably not worth it. And in fact, fun fact, usually people tear more on their first deliveries than they do on subsequent deliveries. And moving back to perineal massage, I actually saw some studies that said perineal massage wasn't helpful if it wasn't your first baby. Now, I have seen other studies that said that it was, but if you're like, it's my second baby, I didn't have to push long the first time, this is such a pain in the behind, I really don't want to do perineal massage, then you can just skip that part. But if you're pushing for kind of a while, I think it'd be awesome to ask your nurse, hey, could you put a warm compress on me down there? Now, sometimes nurses get so caught up in things, they don't even think about it. I personally if you started to swell, I tried to do ice and then a warm compress, kind of alternate between the two. I haven't seen anything about ice helping at delivery. So personally, I would go for more warm compress now, but sometimes when you just ask your nurse, they're going to be cool to put one on and it might prevent tearing at your delivery. I think the idea here is that it just keeps the tissues a little bit more supple, a little less likely to be swollen and angry or irritated. And so when you push that baby out through the perineum, you're less likely to tear. Okay, this final thing you're going to be doing right at delivery. So as the baby exits the birth canal, that is a time when your provider really engages and talks about how you should be pushing. So often they're going to say, okay, just small pushes right there at the very end. You got to think that it's like you putting on a super tight sweater, right? The neck is very tight and, it's just slowly extending over the head. So your doctor will be using things to help assist the sweater, being your perineum, over the baby's head. And if you just try and bust through that sweater, you might break the sweater, aka tearing. Or if you take your time to really let that sweater stretch and extend, and then, they ease the sweater on over the head, it's just a more gentle way and you're less likely to tear. Now, one of my most viral videos is me saying that I think the worst tears that I have ever seen are unassisted vaginal deliveries at home, meaning somebody did not plan on delivering at home and then they just have their baby. Often those people are standing and they're unable to control their pushing at the very end and it just comes out. So I think it's really important to remember that your provider at the very end is doing things to assist you in not tearing. So really be sure to listen to them. So those are the 3 things, but I do hear people say frequently that things like getting the epidural is going to increase your tearing. Studies do not show that, especially when we compare baby size to baby size with an epidural versus not with an epidural, because we have to remember that people who have more complicated births or possibly a larger baby, that labor is taking longer, they're more likely to get an epidural. So when we confound for factors like that, the epidural is not shown to increase tearing. I also see other people say coach pushing, which means when we're like counting to 10 and telling you to push causes increased tearing. Also not true. So these 3 things have been shown in studies to decrease tears at delivery. I hope you found them helpful. Which ones are you going to employ? Are you interested in perineal massage? Will you be talking with your provider about it at your next prenatal appointment? I can't wait to hear how it goes. Tell me in the comments if one of them appealed to you more than the other. If you like this video, please give it a big thumbs up and follow me so we can hang out for the rest of your pregnancy.